All right. If you are here for adult education, please grab a seat. We're a few minutes late today because we had an epic Rock Kids musical this morning. So grab your refreshments and come and take a seat. We're going to get started. So, as I believe you know, this is our last session of adult education before we break for summer, because next week we go down to one worship service a Sunday. That's our summer schedule. It's a little scaled back. Our services during the summer, it's just at 9:30 a.m. So this is our last adult education. It has been a great year. We want to encourage you to come to the annual meeting on Sunday, June 9th. And we'll be kind of doing a recap, a look back of the year, and a little bit of a look ahead to what's next. And so you'll get to hear a bit of recap of what we've done in adult education this year. I'm going to be sending out we're really into surveys this year. I'm not going to send it out just yet, but I'm going to be sending out an adult education survey. It'll take you like maybe 4 minutes. But that's just to find out kind of what your impressions were of the classes this year and what sorts of things you'd be looking to learn in the year to come. So that helps me with my planning, particularly over the summer. But I would like to turn it over to our Mental Health Matters crew, and I'll just open us with a quick word of prayer before I do that. Holy Spirit, on this Pentecost Sunday, I am grateful that your presence transcends time and place and all the boundaries that we experience in this life. I thank you that you know where each and every one of us has been in our lives up to this point. You know what we bring with us into this room this day. You know what kind of experiences we have with loneliness or what the people around us are experiencing and how you want to use us to do your work in this world. So I pray this morning as we meet, as we learn, as we listen, as we talk, that you would open our eyes to new ways to be your hands and feet in this world. Thank you for this Mental Health Matters team, for their passion, for their enthusiasm, and for the ways that they are really trying to follow your Spirit's leading for our church. I pray these things in the name of Jesus Christ. Amen. All right, Deb O'Hare, let's give her a warm welcome.
Thanks, everyone. It's so great to see you. It looks like the sun and the kids brought a lot more people out, which is great. So we are going to do a quick class. We're going to go through this stuff really quickly because we got a little bit of a late start. And those of you that were here last week when we talked about emotional first aid already know some of this stuff. So Rich, if you could skip us on. We want to introduce our team. We have 3 of us here today. Mary Beth Drew, right here. You can't miss her. She is very bright today. You win. You have the absolute brightest costume. I mean, not costume. I'm sorry. See, this is why we all need mental health training here, because that was... and Allison Young is over here, and she's going to be introducing our guest speaker today, Marcia MacKillop, who is standing over there by the wall. We didn't make her stand by the wall, but... So, Mary Beth Drew, Marla, she presented last week. Stephanie McMahon, who's busy moving her kids in and out of college. Lisa Newman, myself, and Allison are all on our team. You guys can just read this. We're going to go really quickly through this. So we do have a mission statement, and I'm going to let you read this. I'm not going to read it out loud to you because I'm sure that we can all read at our own pace. We'll just look through this quickly. So we do have 4 intentions: raising awareness, supporting, advocating, and encouraging. We are currently working on fleshing those out so that hopefully the next time we get to meet with everyone, we'll have some more definite ideas as how we're going to be doing these things. Okay, Rich. So I do want to tell you about an opportunity that's coming up. We are going to be offering mental health first aid training here at Allentown Presbyterian Church. It is a nationwide program. We have a trainer from TCNJ who will be coming. Well, he actually has 25 trainers. He's not bringing all of them, but he's going to bring some trainers. We're going to be meeting at Crossroads. We have a tentative date of Saturday, July 20th. So this is one of their statements that sort of outlines what their program is about, which I think is something that everyone would benefit. And I'm going to give the microphone over to Allison because she is going to tell you a little bit about this because she's a proponent of this training, and she's also going to introduce our speaker.
Good morning, everybody. So just really briefly, there are two different versions of mental health first aid training, one for adults and one for youth, and I did both of them. So many useful little tools to help you understand and think about how to relate and respond to people who might be having difficulties. So it's not therapy whatsoever, but just helping you really conceptualize what might be going on and help to point people in the right direction. So I really encourage everybody to make time for this. It's a whole day training, but so well done and really, really worth it. So we're really glad you're all here this morning. And I want to introduce our speaker, Marcia MacKillop. Marcia is a Presbyterian minister and therapist, so she brings that combination of skill as a therapist and the spiritual dimension. So come on up, Marcia. We're so glad to have you.
Good morning. I feel really privileged to be one of your speakers to come up and be with you today. Thank you very much for inviting me. Thank you, Allison. She already let you know that I'm a minister and I work as a parish associate at Presbyterian Church of Lawrenceville. So I do a lot of leadership with worship and any kind of interesting initiatives. But one of the initiatives is that we have a community well. It's a resource reaching out to the community. So we rent space and we just are trying to always evaluate what the community needs. And mental health has been pretty big. We had a center that kind of got squashed during COVID and never really came back. And I felt a calling and a leading for many years that I kept pushing down. How could I do that? How could I afford to do this and have my own practice? And then one day the pastor asked about our legacies, and I was like, well, that's it. I didn't feel comfortable in where I was working in mental health for many reasons. So I started my own practice. And the interesting thing about my practice is I have a leading and a calling to also talk about our spiritual health. So lots of times you'll go to a counselor and they're going to talk about the physicality of mental health and the emotional part of mental health. But what about the spiritual? What about our faith practices? What about our belief system? And how can we deepen that and also say, like, that's also what we're using to treat our mental health? So that's my calling and that's where I am. October of 2023, I began in solidarity counseling practice. And I call it that because I really don't give advice. I really want to be on a journey. You're not alone. It's a very scary thing to tell people what's going on. It's still stigmatized. I'm with you. Let's explore together what's going on and use the aspect of our spirituality and also our faith practices. I mean, we learn about mindfulness and deep breathing and sitting with ourselves. We have a prayer practice that we can utilize and call upon God for help. So that's kind of where I am. And the last thing I'll say is that I started a group. I've been doing some adult education in my own church. I started a spirituality group, kind of a once a month. Let's be intentional about our spiritual practices. Let's share who we are and share resources. And that's been pretty good. I've had anywhere from 4 to 8 people show up. No cost, no fee, just drop in and let's talk about our spirituality. Today's topic is the epidemic of loneliness. In May of 2023, the U.S. Surgeon General put out an advisory report on the epidemic of loneliness and isolation. So I thought in order to get a sense of it, I'd let us see a little bit of a YouTube clip with Dr. Vivek Murthy, and he can kind of get us going. I know last week you talked a little bit in the TED Talk about loneliness, but it's not going to surprise you. I did do like a PowerPoint presentation to break down some of the data. We'll go through it. I'll probably go through it a little quicker than I would have because we're running late, and then I want to have discussion and maybe bring back what your mission is here and all the things that you're doing, because it seems like this is a perfect environment to address loneliness because you have a lot of ways to reach people here with all the different groups. So yeah, let's put on, and I'm not sure where I'm stopping it, but I'll just give you, Jim, the, yeah.
About loneliness. Loneliness is an experience so many of us have, and it impacts both our mental and physical health. Hello, House Calls family. I'm so glad that you're joining us today. I wanted to do this special Q&A session of House Calls on a topic that I'm passionate about, and that is loneliness and isolation. This week, I released a new Surgeon General's advisory on our country's epidemic of loneliness and isolation. This is the first time that a Surgeon General has issued an official publication on this topic. Now, the reason I'm doing this is because loneliness and isolation are at the core of so many of the health issues that we're facing as a country, and we truly are experiencing a crisis of disconnection. Around half of people in the United States have reported experiencing loneliness, with some of the highest rates among young people. And over the years, the number of people with close friends is decreasing. As I've been traveling the country talking about this as part of our broader mental health challenge, there are some common questions that have come up. People ask, what does it mean to feel lonely? How does it actually impact us? How's it different from being alone? And there are many more questions. I've decided today to answer some of these questions right here. And I also want this to be a two-way conversation over time. So as questions come up for you, please reach out at housecalls@hhs.gov. And please do read the Surgeon General's advisory on loneliness at surgeongeneral.gov/connection. Let's get started. So one of the most common questions that I get is about how loneliness and isolation affect our health. Now, many people are surprised to know that loneliness is more than just a bad feeling. It has a real impact on both our mental health and our physical health. It turns out that people who struggle with loneliness and isolation are at increased risk of depression and anxiety, but they're also at increased risk of cardiovascular disease, dementia, and of other physical conditions, including diabetes. Now think about that for a moment. That's really striking because we think about obesity and about tobacco use as real public health concerns. But it turns out that loneliness and isolation are on that level as well, and they should also be public health priorities because of their impact on our physical and our mental health. Now the flip side of this is that when we strengthen connection in our life, it can have a real positive impact on our health and on the well-being of our communities. You know, in addition to reducing our risk of heart disease and dementia and diabetes, it can also strengthen our immune response. It can improve wound healing. It can reduce our risk of depression and anxiety. And when this happens at a population level, then we find that the benefits are really quite extraordinary. In the workplace, for example, we find that greater social connection can aid in creativity and in productivity. We find that when kids are more connected in school, it actually helps their performance in school. So however you put it, being connected to one another is foundational. It's at the core of what we need to have as human beings in order to show up in our lives and in our communities. That's why addressing the crisis of loneliness and isolation is so important. Another question that we often get is about types of loneliness. Are there, in fact, different types of loneliness that we experience? And the answer is yes. And I'll start this by also saying that there's a difference between being lonely and being alone. Being lonely is about how you feel. It's feeling that the connections that you need in your life are actually greater than the connections you actually have. It's feeling that you may not have someone to share important moments with, or to reach out to if you need help, or to support you during difficult challenges, or simply to experience the highs and lows of life together. And that's different, though, from being alone. Being alone is an actual objective description of how many people you have around you. And the reason this distinction is so important is because I remember very early on when I was serving as Surgeon General back in 2014, traveling to communities across the country and realizing that there were young people on college campuses where they were surrounded by many people, but were saying that they felt really lonely. So you can be surrounded by a lot of people, but if you're not feeling connected to them, if you're not feeling like you can be yourself around them, or you can be open around them, then you may feel lonely. And the converse, though, is also true, that you may only have a couple of people around you, but if you're actually deeply connected to them, then you may not feel lonely at all. Now, there are different types of loneliness I think of in three buckets. I think about intimate loneliness. That's when we are lacking in these deeper connections that we have, let's say to a spouse or to a best friend. There are also relational connections, or relational loneliness, which is what we experience when we don't have the kind of friendships where we may have somebody over for dinner from time to time, or we may get together with people for vacations, or simply to watch a game together, or to enjoy a birthday party. And then there is collective loneliness, and that's when we lack a sense of community. Now, community can come from being part of a faith organization. It can come from the work colleagues that you have. It can come from a volunteer organization that you're a part of. But we need these different types of communities. We need intimate connection. We need relational connection. Those are our friends. And we need collective connection. That's our sense of community. And the reason this is so helpful to understand is because knowing that you need all three explains why some people can actually be in a great marriage, let's say, or a great relationship, but still feel lonely if they don't have a good circle of friends, or if they don't have a sense of community, either through work or through volunteer activities. And if you don't know this, then you might think as a partner that, hey, if my partner is lonely, that it's my fault, that something is lacking in our relationship. But that's not necessarily the case. We need these different types of connection in our life to feel truly connected and to not experience loneliness. Now, another question that people are often curious about is how bad the problem is. Are we really lonely in great numbers in our country, or is this just a problem that's affecting a few people? Well, if you had asked me the same question 10 years ago, I would have probably told you, yeah, this is probably an issue for just a small group of people. But I've learned a lot since then. I've learned a lot in part by talking to people around the country who helped me realize that loneliness was something that people across age groups were struggling with, that people in urban and rural areas, people who were working in large companies surrounded by lots of people, and people who were working alone at home, that they all seemed to be experiencing. And when I dug into the data, I realized that it's around 1 in 2 Americans who are in fact experiencing loneliness. And the numbers, in fact, seem to be greatest among young people. This might be counterintuitive because we think about folks who are younger as more connected on technology, whether it's through their phones or on social media. But that doesn't necessarily mean that you are more connected. And in fact, depending on how you use your devices and how you use social media, sometimes that can actually be harmful to your sense of connections, or to the quality of your connections. The bottom line is loneliness is extraordinarily common. And it does look like, particularly during the pandemic, that loneliness did increase for many groups. There are also trends that have been taking place for decades in our country where participation in the organizations that typically brought us together, like community-based organizations, bowling leagues, faith-based organizations, that participation has decreased a lot in the last 5 to 6 decades. And that's part of what has contributed to the loneliness that we're facing today. Now, how do you know if you're lonely? Well, we all feel lonely from time to time. That's important to state from the outset. Loneliness is like hunger or thirst. It's a signal that our body sends us when something that's essential for our survival is missing. Now, if you feel lonely, and you pick up the phone and call a friend, or get in your car and go see someone you love, or adjust your life in some way that allows you to spend more time with people you care about, then your loneliness may be short-lived. But for many people, loneliness persists for a long period of time. So a lot of people are walking around and, they may seem like they're perfectly fine, that they've got lots of people around them. You may look at their social media feeds and see that they're, at parties or at events, and they constantly seem surrounded by other people. But don't let that fool you into thinking that all of those people are not experiencing loneliness, because a lot of them, in fact, are. And we know this from the data, and I know this from so many stories that I've heard from people around the country who feel like they have to put on a brave face, who feel like there's a stigma around being lonely, and that they don't want to somehow make it seem like they're not likable or not lovable by admitting to their loneliness. But the reality is that this is a real experience that many of us are going through, and there's nothing to be ashamed of. It's
a lot. And what I've tried to do is make some slides to kind of go through a little bit about what he said in a simpler form. I'm going to skip some for time constraints, but I wanted to just bring up how important, I don't know for you, but how important being involved in our faith community can really be. Like, you could go to church and kind of just go to worship and then get in your car and go home, and you've done that. But it's kind of like, if anybody knows about the 12-step AA meetings, it's the same kind of thing if you just show up at a meeting and then you don't tell anybody who you are or why you're there. I mean, you just feel so much more connected when you can get involved and you can serve at the church on a committee or youth and really get to know who your community is. So where do I want to? Okay. So I think you're going to give me a clicker and I'll go through. Yeah. I have to look at this. So it's this way? Okay. All right. I guess I always want to say, so why is this important? Why am I here? And why are we talking about this? So we're wired to be in relationships with people. So when we're not, it's not normal and it doesn't feel right. So family systems, our own family, the church is a family system if you don't know that. It operates the same way. So who is our community and who is our neighbor? We talk about that. There's a lot of biblical references that we talk about, and I think for me, hospitality pops out the most. But you can read like banquet, sitting at the table, sharing bread and cup. The Hebrews passage, I kind of broke up into 3 different things about let mutual love continue and do not neglect to show hospitality to a stranger. For by doing that, some have entertained angels without knowing it. And I think of those 3 stories. Was anybody surprised to hear that the main demographic are the youth and the kids that are so lonely? No? Okay. All right. I was. I don't know why. I thought that picture was really striking. So 1 in 2 U.S. adults reported experiencing measurable levels of loneliness. Across age groups, people are spending less time with each other in person than 2 decades ago. So if you're younger, you wouldn't know that, but we used to play outside. We didn't have technology, so we were, forced to pick up the phone and talk to people, and, people would just show up. They would visit at our house. I remember my grandmother, people would just show up, and then we would get out cake and coffee and tea. Like, that's just what we did. Now we text to ask permission to call you. It's very different. So he said that the pronounced group is 15 to 24, who had 70% less social interaction with their friends. And we know all those people that want you to think that they're very happy, and they're posting on Facebook what they have for dinner and what trips they took, but we don't really know how they're feeling inside. Amounts of time spent alone increased by 30 minutes from 2003 to 2019, and then they said after COVID you could add another 20 minutes, so that's working towards an hour. Okay. He talked a little bit about the difference between social isolation and loneliness. You can kind of read that. Social isolation is objectively having few social relationships, social roles, group memberships, and infrequent social interaction. So that's where I think a church like Allentown Presbyterian Church, from what I've learned, you have so many different groups and things going on that people could really, all you have to do is invite people, and maybe you have to invite them a couple times. But I think it's a way to connect. That's a little bit of the data. I think the way he was advertising this is that if you smoked a half a pack of cigarettes a day, that's the same thing of what loneliness can do to your health. Yeah. And I have these slides. I guess you guys can access them because I do have a lot of the websites, and at the very end I have some of the resources. If you want to look at the report, it's 59 pages. That's why I try to tease out some of the important pieces of it. He's also done one on teen mental health, also in May of 2023. I did a whole presentation on that. I really loved his podcast. He's very gentle and spiritual, and I find myself very moved by a lot of the interviewees he has on his podcast, House Calls. Okay. This is a little dense, but what he's saying is the remedy for all this is social connection. So that's why I'm here to talk about social connection. And he's saying that biology, like the stress hormones, we know that that leads to inflammation. Lots of times when we're stressed, we end up with other illnesses because we have too much cortisol. It also can be genetic. Also how our physiology, that's a big word, meaning, purpose, stress, safety, resilience. There's a connection between social connectedness and being connected socially to being resilient. So we can teach our kids, and at the end of his report, he talks about what you can do individually, what you can do as a parent, what you can do as a community. Really great ideas of how to promote social connectedness. And then the behaviors. So basically, you can read through it, but it's saying that the effects of social connection, isolation and loneliness on mortality are comparable in some cases, higher than, the risk of lifestyle factors like the smoking and alcohol and physical inactivity, as well as traditional clinical risk factors like our blood pressure, body mass index, cholesterol levels, and environmental factors like the pollution and some of the things that happen with, the vaccines and high blood pressure and medication, blah, blah, blah. But this is really important. The social isolation is associated to higher rates of all these physical things and also lead into our mental health. Some other things that I thought were interesting in his report was we have less trust in the community. And I don't know if you see, but if I see a kid like in a neighborhood walking by themselves, I'm like, oh my gosh, where is the parent? When we were younger, okay, I was born in the 60s, but when we were younger, we went out and we played and our parents screamed, come home at 5, and, they just let us go. We were in cars without seatbelts. There were all kinds of changes, but it makes sense that now that, trust is less because can't even go to church without being worried if a shooter's coming in. You can't go to school. You can't go to the mall. I mean, there's so much that's changed. Half the country reporting 3 or fewer friends, which is double from the 90s. The technology advances. So we know, I don't know if you must live stream church, so a lot of people aren't coming to church anymore because of COVID, like it's easier. Meetings, work. I don't know how many people here work from home and work online? Doesn't seem like a lot, but yeah, or now there's hybrid, now you go in a little bit, but we used to always have that conversations and that social interaction and going to lunch with each other and, gossiping around the water cooler. Anyway. People are less likely to get married, having few children. I don't know much about that, but we do know that it's harder to get people to come to church. That's people are going, there's soccer on Sundays. There's a whole host of things that the church competes with on Sunday that we didn't used to have to compete with. Okay, and then there's more single people, more people that live alone. that have their own apartments than they did years ago. Okay. And then other risk factors such as like the demographics of our community and living alone. Okay. So mental health, that's why we're here, anxiety. So one thing I wanted to say about anxiety, and I probably have it written a couple places, but sometimes we're just sitting here thinking, well, we'll reach out and we'll have people come in, but if anybody knows anybody with social anxiety, there's this 24/7 fear that somebody's, what somebody's thinking of me, what somebody's thinking of me. So they avoid everything that makes them feel that uncomfortability, which makes their anxiety worse. And for example, I know many people I've worked with that will just hold that anxiety and suck it up and go to work and try, to just get through the day and come home and kind of just crash in bed and have like this depression. So it's just not so easy. In my office, I have a door that you can walk out from my office, and then you can't walk in from it, but you can walk out. And I have one person that has extreme social anxiety, and she's the only one that will walk out that door because she's just terrified to interact with other people. So the anxiety is tough. Depression's tough too, because at least with anxiety, we can help people with tools to bring down the anxiety, like the deep breathing and mindfulness. But with the depression, you feel so low, it's hard to really do the things you need to do, and you need to get outside, and you need to talk to people, and you need to make phone calls, and you need to connect. And your depression tells you all kinds of things that aren't really happening. So we have a lot of stress. Isolation can lead a person experiencing a high amount of stress, which affects mental well-being, as well as causing the body to release the stress hormones like cortisol. I've had patients that have had anxiety-related illnesses for a long period of time, and they also have autoimmune, and I think there's a connection there. Okay, and then I wrote Catch-22, being in poor mental physical health is associated with more isolation, suggesting that loneliness not only contributes to poor health, but perpetuates it. I'm gonna kind of skip through this because it's a lot. So, social connection. Social connection can encompass interactions, relationships, roles, and the sense of connection with individuals, communities, or society. And so if you look at like the structure and the function and quality, so you might have a lot of friendships or you might have a lot of people you see, but what is the relationship like? Like people will tell, I have one kid who tells me he has 20 to 40 friends, and I don't really believe that, but he thinks he does. But there's nobody that comes home with him. There's nobody he can invite to come over after school. There's nobody that he would tell what's going on with him. And I think like the type of relationships we have are very important, the quality of the relationships. It's just another of the same. So Dr. Murthy's been around, he's been on NPR, he's been in articles, but he came up with like 6 ways to address it. And so parks, libraries, programs, places that people can go. There's not always some of that in some of the poorer communities. Like, there might not be a library that's safe to go. They might not have programs because they might not have the financial ability to have programs. Just let you read through that. But this is the main thing I wanted to sort of say, that he says that the remedy to loneliness is social connection, which I said at the beginning. So he says service is a powerful antidote that we have. I had a patient I worked with for several years that didn't really have the language to talk about God, or I doubt that she was a church person, but when she went out and she did volunteer work, that was so different for her. Her countenance, her whole spirit was different. So there are other ways that we can tap into spirituality. And I think that service is important. Yep. This is something that we can work on. We can build the connected lives that we want. We have to, yeah. Social connection is, he says, social connection is a medicine that's freely available that could improve our mental and physical health. It's medicine that's hiding in plain sight. Social connection can be a source of healing. Sacred spaces, like he says, like if we put the phones away at dinner time, like that's not when we're going to talk to each other. We're going to connect with each other. There's all kinds of ways to do that and to manage the digital environments that we have power over. Like, are we just going to scroll on our phone mindlessly, or are we going to try to read a book or connect with people? Like, there's ways that we can work on that. Okay. Getting nervous. Okay. All right. I don't know if I need to talk more about depressive symptoms, but I mean, I think everybody knows I kind of keep some of these slides. So, all right. So let me look at my notes because I think I want to start, I want to start some conversations about it. I don't know if you have any questions. I would imagine you want to. I went over, I went over most of the stuff that I wrote down here. Yeah. So is that slide? Yeah. So I wanted to start having some conversations about it. I mean, it's a lot of information. Some of it is, a little dense in the slides. Some of it's a little dense, but I think the main thing is how do we take the mental health matters and some of the initiatives that you, like advocacy and education, and how do we tie that into how we as a church can be the church and reach the people that are lonely and that have mental health. And that's not something that people are coming up and telling you about, maybe, in one-on-one conversations. So with what Dr. Murthy presented and what I was trying to show in the slides, what do you think was surprising or moving? You can pick any of these questions. Why is it relevant to our church? Maybe you want to discuss, Allison and some of the members, what you're doing to address it. How we can build, how you guys can build on it with people in this room. Like, how do we just build, I guess my bolded one is, how do we build social connection into our ministry and mission? So I wanted to start some conversation about it.
Yeah, do you need them? No, he said no. I was surprised by the 3 different types of loneliness, right? Particularly where you may have a spouse and everything's great, but you don't have the other components, you can still experience that loneliness. And so, I've got family members that say, I worship out at home, I don't need to be in community, but there's a good reminder, right? You do need community, so that was surprising.
Yeah, I've heard many people say they're lonely in their marriage, and sometimes that has nothing to do.
Make you travel all the way over to the other
God.
My wife and I on a mission, we have found out that the way to make the mission continuously in somebody's mind is to have a social event that's wrapped around it. So if you went to Maine in a particular year, you should do a little reunion. We do it with the Guatemalan people. Suggest it to anybody. It's a really nice way of keeping in touch and providing a social function.
Thank you.
I want to reinforce that. That's what I was thinking too. The women's retreats are, and not everybody can come or whatever, but you disassociate yourself from the real world for one weekend and just being with women and their concerns and often beautiful nature and just reaffirming the power of God in your lives. And then you go home and you join back, but then we usually do some kind of a little reunion thing, and it just brings all that back and reminds you of you're not alone, and I myself, I've been going to retreats for years, and they're just so powerful on many different levels. And the reconnecting maybe a month or 2 afterwards is always a good thing too, because you keep that thought process going, so.
Yeah, I just feel like that last point that you were making about is so critical because, Jesus said, if you lose your life, you'll find it. And I think for a lot of people struggling with loneliness, it becomes very like, how am I feeling and what's happening to me and why don't people call me and, I feel all alone, and it's very self-focused and self-centered. And Jesus said, the less you think about yourself, the more you think about other people, the healthier you become. And, that's why I think, being a part of a faith community that just emphasizes that and gives opportunities for people to serve others and think about the needs of other people and then get involved with others who are also doing that. And, there's just so much health connected to service. And, it seems counterintuitive. It seems like, oh, now you're not taking care of yourself. Oh, you're thinking about other people. But it works the opposite. And it's just so beautiful, that story that you told, just get out there and find a need and get involved with other people who are doing something about that need, or go on a mission trip, or, volunteer, or become part of something else. And then the second thing is that, as everyone in this room knows, since Lindsay came, we've just put such an emphasis on getting into a small group. And I think most of the people here are, but if you're not, that's a weekly group of people who go deep with one another, who share, who talk openly and freely, and look forward to that time. And I think for a lot of people, all you have to do is, say, I want to be a part of a group, and there's so many choices, and that's just a tremendous opportunity to strengthen those social connections.
And it makes me think of the people that I work with, and there's one in particular that says, I don't sign up for anything. So it's almost like we have to kind of really find who are they, and to be able to sort of outreach them specifically, one-on-one, to see if they would come to a group and invite them to come to a group. And I love what you said about the women's retreat. And I think a lot of the loneliness, a lot of the anxiety and the social anxiety, or like you're spinning in your head and you're telling yourself all these things that really aren't true. I always say, especially to kids, where's your evidence? Is that really what's happening, or is that just a feeling? And so there's a lot of low self-esteem. And I think in particular, and I had this experience myself in my 30s and 40s, kind of even late, being around other women reflected the goodness that I couldn't feel myself. And it gets in these small groups, some of that stuff that we were playing with or thinking about, really, it's embraced. Other people love us. Other people really do like us and want to be with us, but we just isolate. And so it just depends, kind of where you are on the spectrum, whether you struggle with mental health or not, or what age you are. But that kind of self-esteem is linked pretty heavily. And so we have to really build and encourage our kids. And one thing that Dr. Murthy said in the teens mental health thing is every kid needs that one adult that's not their parent that they can go to, that they can talk to. So a lot of us probably in this room are teachers or coaches or Sunday school teachers or youth group teachers. They just need somebody that isn't mom or dad that they can go to and talk to and be that one adult in their life. And that makes a huge difference in their mental health. So if you're that person, think about that.
One of the things that one of our endeavors in the mental health team is to recognize all the various ministry groups that are already operating in the church, and how can we as the Mental Health Matters team provide resources and connection with things that are already going on. I have a passion for finding the people who aren't involved in anything, who are the people who aren't signing up, who aren't joining small groups, who for whatever reason are not involved in any of these many things in this remarkable church that are going on. So I would just urge all of you to think about that and give us feedback as you think about it. Who are the missing people and how do we connect with them?
Pray about that, right?
Yeah.
Pray, help me find them.
Yeah.
Okay, we have her and then you.
I think as part of the church component of it, a lot of times people come to church and they hear Jesus loves you so much, God's always with you, and then you leave and you go home and you think, I don't feel God, I don't feel like he's with me, I don't feel like he cares about what's going on with me. And sometimes the littlest gesture, like if I get a text message, sometimes someone will send me a text message and just say, I was thinking about you today, or I saw your kid smiling and just brighten my day or whatever. And just the littlest things can really reconnect you, not only to the people around you, but sometimes even to your relationship with God. Because sometimes you might think like, I think God's forgotten about me. And so as part of the church, it's not just connecting with other people, but I feel like it also reconnects you in your spiritual life too.
God uses us. God uses people to let him know that God loves us. And so, yeah. Sorry.
I think what Stephen said really hit home for me. The happiest times in my life were when I did more volunteer work. And the other thing is, having been a home care nurse for many years, I identify with the elderly being lonely. I realize that teenagers are, but my kids are beyond the teenage years, and I'm getting elderly. And I see that I saw so much loneliness in my career. So many elderly people live alone, and so many of those people have family that live in distant areas, like my children live in Boston and California. It's really difficult, I think, when you're all alone, and especially as they get older, maybe they can't drive anymore, maybe their eyesight's not so good. I'm beginning to experience that with my eyesight, and it's really frightening, and I can really understand elderly people more than I can teenagers, I guess. It's just where my gift lies. And I just think that that's a big area to not overlook.
No, thank you for that. And that's something that our culture, our society doesn't value. I mean, everything is about anti-aging and continuing to look young and continuing to look a certain way. So we need to remember, I've been so aware as I'm getting older how important it is to, most of my ministry right now is because I take Medicare, are older people. I also took it because people who have disability incomes also get put on Medicare, and I wanted to be a therapist that people could reach out to and not be in a community mental health system, which sometimes is 6 months to get in. But I appreciate your thoughts, and we need to meet both. And I was at one church, and we were talking about, is there a way to do something with the elderly population and the teens, and a way to connect them, because that's I'm not trying to add things to all that you're doing, but I remember reading years ago about some teens that put on a prom for a nursing home, and it was just really fun for both populations. So somebody over here.
It's actually along the same lines. I was going to suggest something practical. My mom is in a memory care facility, and so I visit her, and it can be really challenging to connect with people who have dementia because they don't always give anything back. They don't always know even what you're talking about. And so my sister and I sort of team up and go together. And so if my mom is zoning out and not really responding, we just sort of carry on a conversation around her, and every once in a while she'll ask for a slowdown or an explanation, and that. So having a team member helps. And also, when you go over to a memory care facility just to visit one person, you get to know all of them by name. And you come and they recognize you, and you can stop and talk. It really makes a big difference. one Sunday we were there and the football game was on and nobody was really paying attention. So my sister and I started watching and we were yelling on, engaging in the game. All of a sudden, all these old people were yelling. They didn't know what they were yelling about. So it can be a matter of having somebody to help with you.
I just wanted to say, 5 more minutes? Great. But I still wanted to say, so basically, we all need to be involved. We have a team, we have a core team, we have volunteers that are willing to help, but we need every single one of you to help us fight this loneliness epidemic. And you can do that as simply as reaching out to someone that you know is struggling. You can tell us about someone that you know that's struggling. We have so many great activities going on in this church. We have meals, we have paint nights, we have women's wellness. Invite someone that you know normally wouldn't come. Say, I'd really love for you to be my guest. Do you need a ride? I'd be happy to pick you up. Offer to meet for coffee down at the Moth. I feel like most of APC does all of their serious work at the Moth. It's so great meeting down there, and you always see somebody from the church having a great snack and talking about how we can share God's love with those that are struggling, and how to make this church a refuge for those people. So it's kind of a challenge for all of us to do this work. And we'll take as many volunteers as want to step up.
Anybody else have a burning desire or a question or want to make a comment? Yes.
Yes, I'd like to make a point. Several years ago, at the end of the church season for classes, a number of us got together. And it was only a handful, but we spent that time. We were fortunate. I don't remember the gentleman's name. Stephen, remember, he went to Florida. He was very articulate. He had great stories to tell. And he shared them with us.
Bart.
Yeah,
Bart Francis.
Bart. The fact that we have a group of people here that definitely are interested in this subject, and now it's becoming more public and it affects all of our lives. Perhaps a consensus should be taken. Would we like to continue that throughout the summer? Just don't stop class and then class starts again in the fall. Continue it. It may work out, it may not, but at least there's an option. And I'm sure that there's people here that could contribute to that and really, add to everyone's welfare.
Thank you. At the end of his report, he has like a lot of different entities what you can do. So what healthcare workers and systems can do, insurance companies, good luck with that. What individuals can do, what parents can do, like it's all great stuff. And I think we've had a good discussion here. Was this helpful to talk about the loneliness epidemic and how, so it affects our mental health and our physical health, but I think I'm always thinking how is it relevant to the church and what we can do to reach out. Any last questions or burning desires? I'm going to end with a poem about loneliness. A prayer about loneliness from Kate Bowler. If anybody doesn't know her, she has a lot of energy, and Dr. Murthy says that she brings so much joy to anybody that she's in the room with, that if that's something we could do, that would be probably end the epidemic.
I have one more thing. Yeah. I noticed, I'm part of one of the small groups in our community, and one of the things I struggle with anxiety and depression is there's certain times of the year when I notice other people, they may thrive, they're happy, they're going on vacation. So for me, this is like summertime. So for me, summertime, for some reason, it's just a very lonely, triggering time. And I think that if we could talk more about that and have more support on like those seasons in life when other people are, you know, maybe excited for Christmas coming or, you know, summertime, stuff like that. I think we need to focus more on those things and those times when we're breaking and we don't have small group to go to. So I noticed that's a struggle for me.
Thank you very much for bringing that up, and that was very courageous too, to let people know how you're feeling. And I think that that's very true about mental health. There are different seasons, there are different times, and it can be lonelier. And I tend to do around Christmas a mental health group to remind people how to take care of themselves and help other people that aren't feeling joy. Okay. Thank you very much for letting me be here. I was a little intimidated by live streaming and being on YouTube, but I really appreciate it. And I'm glad to come back for smaller conversations, but I really do support the work that you're doing, Allison. So, and I left a lot of information in the back about me and my practice if anybody has any questions. But I want to leave with this prayer. For When You Feel Lonely by Kate Buller. Let us pray. God, there is a space here in my heart, in my life, I wish others could fill. Would it be embarrassing to admit that I'm lonely? I need someone walking with me, whose eyes see what mine do, whose ears are open to hear my thoughts, and whose heart can be cracked open a smidge more. I was not built to do this alone. I feel it in the transitions, God, in the moments I need someone to call after a memory I don't want to forget. It feels like leaning back without knowing if I will feel the comfortable weight of being held. Could you remind me that I am loved, that my needs aren't too much, that my personality isn't too absurd, that the details of my life deserve a record kept by another? Give me courage to look in new places, to risk reaching out, making plans with acquaintances who might turn into friends. Give me peace. Give me hope. Give me people. And in the meantime, remind me that lovely moments are still ahead. Amen.
Thank you so much. This has just been a tremendous class and a great way to wrap up our year. Could you turn to the person next to you and ask them, have you taken the survey? All right. Did anyone next to you say no? Have you not taken the survey yet? We have 1 week left for this congregational survey that is so critical for the leaders of our church to hear from you, from all of you, so that we can begin to plot the future of where we believe God is leading us. If you don't know what the survey is, if you haven't gotten a link to it, you can come back here in about an hour after the 11 o'clock service, and there will be people here with laptops to help you take the survey. And it'll take you about 20 minutes, a half an hour, and you can do that if you need help with it. Otherwise, if you haven't gotten the link, let me know and we'll send it to you right now, and you can take it this afternoon. But please, before Friday, take that, to find those 20 minutes and take the survey so that we can hear your voice helping us look at ourselves and see where we're going. Next Sunday, we go to one service only. It's a Memorial Day weekend, and we're going to change our schedule. One service, worship service at 9:30. One service at 9:30, beginning next Sunday through the summertime. And we look forward to that. But we're going to go over, and the kids are going to lead us in worship. Thank you, everybody. Thank you.